I hear you're getting ready for your colonoscopy. I am here today to walk you through step-by-step your bowel prep instructions. Okay, so first of all, what's the bowel prep? So if you've never had colonoscopy, you may be wondering, what is a bowel prep? So we need your colon to be nice and clean whenever Dr. Sinha goes in and takes a look. So for a screening colonoscopy, she's looking for polyps, right? Polyps are where the vast majority of colon rectal cancers start from. And some of these polyps can be flat like a carpet. So we need that colon to be nice and clean so she can see not just small polyps or flat polyps, but also any bleeding, ulcerations, any tissue that doesn't look right. If you've got stool or sludge, lodged up against your colon wall, she's not going to be able to get a good view. So we want you to be nice and clean. This starts actually 2 weeks before your colonoscopy. So a lot of our patients that we see today are on GLP-1 agonists or other medical weight loss or diabetic medications that can slow your GI motility and kind of predispose you to constipation or make things harder to clean out of your colon. So we are going to need you to hold certain medications for 2 weeks prior to your colonoscopy so that you're not backed up, right? So that your bowel prep actually is effective and works. So 2 weeks before your colonoscopy, if you're on any of these medical weight loss medications, we will have you hold those medicines for 2 doses. And then a week before your procedure, we're going to ask you to have no nuts, seeds, corn, or whole grains, because these things can be really hard to flush out, but great for you. So, if you like nuts, you like your peanuts, your cashews, whatever you like to eat, they're great for you. That Mediterranean style diet is wonderful for, colon health, metabolic health, all that good stuff, but they're hard to clean out. So Dr. Sinha, last thing she wants to do is go into your colon and see a big wad of nuts, right? So no nuts, seeds, corn, or whole grains for 1 week. And I know it's difficult, but before your procedure, you need to hold those things, okay? Any vegetables really have to be thoroughly cooked, boiled down. You need to really follow those guidelines so that everything is cleaned out. And then the day before your procedure, we're going to have you go on a liquid diet. And this is important. We want you to consume liquids and be hydrated. If you are not hydrated that day before your colonoscopy, it's going to make the bowel prep difficult to do its job. So the bowel prep, it requires lots of fluids. So when you wake up the morning of the day before your procedure, so say you're scheduled for your colonoscopy Monday morning, 7 a.m. When you wake up Sunday morning, 7 a.m., you're going to go on your clear liquid diet. So this includes things like tea, coffee, ginger ale, apple juice, any juices that you want to have, popsicles, those little Luigi's ice cups. You could have Jello, you can have broth, all the broth that you want, but we want you to be hydrated, because if you are dehydrated, your bowel prep will not work, or we might see a delayed response with it. So all of that day, you're going to be on your clear liquid diet, you're going to be sipping your fluids, and then depending upon what time your procedure is scheduled for on Monday, if it's that 7 a.m. appointment, or maybe you're scheduled later in the day at 3 p.m., it depends on when you're scheduled, but you're going to start your big bowel prep, okay, that evening before your procedure.